Okay, chapter 5 is going to discuss medical terminology. This is a lot of probably memorization, I guess, getting used to using these terms. We'll discuss anatomy and physiology, and then we're going to talk about anatomical terms. So when we talk about medical terminology, most medical terms are made up of different combinations. So compounds are made of two or more words. So smallpox, words are made from parts. So the root of the word, so they're using the example of therm meaning heat. That's the root of the word. Then a root with a combining form, brings another term. So the root itself isn't a word until it's comboed with something else. So therm is their example, meaning heat. They're adding meter to it, so thermometer, so heat measure. Prefixes is just like we learned back in grade school. The prefix before it means something to that root, and the suffix is at the back end of that word. So word components example, all right, cardiologist, so cardio on the prefix there, meaning the heart. Ology is the study of, and then ist, one who specializes in it. So most words that you see medical terminology, you can break down if you know some of these bases. Acronyms is an abbreviation made up of initials that's pronounced as a word. So CPAP device, it is a continuous positive airway pressure device. I know when I'm working with my partners, it's going to be a lot easier if I say, why don't you grab the CPAP? And he's going to know what I mean versus, could you please grab the continuous positive airway pressure device? So when you're dissecting these words, cholecystitis, wow, that's a big term, but you can start breaking it up. So if you look at the back, itis, anytime you see itis, it's inflammation of something. Cyst is a closed sac. And then chole is bile, all right? So you've got bile sac inflammation. So it is inflammation of the gallbladder. And you can start breaking up a lot of medical terms like this by slicing the prefix, the suffix, and then looking at that root word to figure out what it means. So when and when not to use it. When we're talking to patients or family members, try not to be getting too technical. Not everyone is versed in medical terminology, so we might need to translate into something that's easily understood for our patients and their families. So complex terms, unless you're sure of what you're saying, it can cause confusion even amongst our fellow healthcare professionals. So if there's a potential for any ambiguity at all, you need to use a simpler term. Okay, so when we're talking about femoral fracture, that's probably fine in medical terminology, but if you said, the thigh bone is fractured, everybody's going to understand what you mean there too. So the language of anatomy and physiology, definition-wise, anatomy is the study of the body structure itself. Physiology is the study of the body's function. So anatomical terms you're going to need to get pretty familiar with. So your anatomical position is when the human is facing forward, hands at the side with the palms facing forward. Okay, so anytime that we talk about identifying structures on the human body, it is not your left or your right, it is the left and right as determined by that anatomical position. We can divide the body into planes, different terms on when we're looking at location. So if you hear the term on midline area, medial is closer to that midline, lateral is farther from the midline. So we had a tib-fib fracture the other day that was lateral, a lateral tib-fib fracture, which means it's on the outside, it's farther from that midline. Bilateral means on both sides. So for example, equal bilateral lung sounds. Okay, we're talking about both sides of the lungs, it sounds clear. Unilateral would be one side. Your mid-axillary line is by your armpit. So if you slice by your armpit there, the body sideways, that's the mid-axillary line. Your anterior is your front, your ventral, your posterior or dorsal is your back. So a lot of these, if you know one, you're going to be able to figure out the other term. Okay, so dorsal, I always think of dolphin's fin in the back there to try to remember those two terms. So superior and inferior refers to the core of the body. So superior doesn't make it better, okay? It just means it's above something. Inferior is below something. So that's referring to something on the core. Proximal means it's closer to that torso, to that core. Distal means farther. So we're checking distal pulses. We're looking at those extremities, right? We're looking at the wrist, we're looking at the feet. Palmar is the palm of the hand. Plantar is the sole of the foot. So here's just kind of a drawing of that. There's that anatomical position. It's laying out when we discuss the torso. Remember, that's the core. Upper extremities are your arms. Lower extremities are your legs. Here's these directional terms we just discussed. Midline, so if we slice the body in half, it should be pretty much symmetrical. As you can see on the top of his head there, we're drawing midline. Proximal and distal, okay, so if we have distal pulses, we're away from that core. Proximal is closer toward the core. Got medial, so if we slice them right down, the medial is right the middle there, medial. And then lateral is, so medial will be closer to where we sliced them in half. Lateral would be farther out. On the diagram to the right here, posterior being the back, anterior being the front. Superior, there's the mid-axillary line if we slice the body in half by the armpit there. And then inferior would be below on the core. The midclavicular line divides that chest into two regions, and there's two clavicles there, there's two midclavicular lines. So if you look back on this diagram, you can see toward the chest there, there's the clavicles, that's the midclavicular line. That is going to be important in future chapters when we talk about cardiology and some other landmarks. So the planes of the body, I will be honest, we don't really use this too much. You just need to make sure that you have these down because this could be a question that might show up on the registry. The sagittal plane or the median, okay, that's if you slice it in half. All right, so that would be the same thing as when we were talking about medial. Transverse is horizontal, so if we slice right up pretty close to the waist there, and then the frontal plane would be your mid-axillary line, okay? So just make sure that you make flashcards or something because those very well could show up. Directional on quadrants, in EMT Basic, we focus on 4 quadrants, the right upper, the left upper, the right lower, the left lower, and just remember that these are in the anatomical position. So if I ask you what's in the right upper quadrant, you should be able to tell me that it's the liver. Okay, it's not what on your right, it's on the human body's right as it's facing forward. How we determine these abdominal quadrants is we slice it right there at the navel, at your belly button there, and that determines right, left, and upper and lower. So as far as knowing what organs and what you should be well aware of, you really should be well aware of all of them, but making sure that you understand where that liver is, the pancreas, the gallbladder, the spleen for sure. And when we talk about which quadrant, it's the majority of the organ. Okay, so the liver, my corny term is liver, not left, so I know it's on the right. So if the liver's on the right, I know the spleen's on the left. So whatever you have to do to memorize that, make sure you know where the pancreas is. The small and large intestine kind of goes all over the place. So make sure that you're aware of that appendix there in the right lower quadrant. Tends to be a little bit of a pain pre-hospital, literally, and causes a lot of medical emergencies. So positional wise, we do use these all the time. The supine position is your patient laying on the back. Your prone is laying face down. You've already had the recovery position lying on the left side. And that is the preferred position for anyone that's unconscious, trying to protect the airway, making sure that they're on their side so they don't choke in case they vomit. So there's your supine, there's your prone, and there's your left lateral recumbent or recovery position. Fowler's position means your patient is seated straight up. They can sit straight up on the cot. The more common position is the semi-Fowler's, or like the reclining position. The Trendelenburg is the one I was discussing in the earlier chapter. For shock, we used to put that head lower than the feet. You don't see that very much anymore. So there's your comfy semi-Fowler's position. And there's that Trendelenburg, or that reverse position. And like I said, you're not really going to see this too often. All right. So as far as memorizing terms, I know in your book you have a lot of, all the terms I've discussed for anatomy, you need to make sure you know. I'm going back up into these compounds. You're going to start knowing some of these roots. I would focus on hyper, meaning high, hypo, meaning low. Tachy, as in tachycardia, being high. Brady, slow. Okay, or sorry, tachy should be fast. Brady should be slow. Those are pretty common. Make sure you know what apnea, or that AP means, not breathing. Dyspnea, DYS, that's short of breath. But you don't need to memorize that whole sheet that's in your book. But do make sure that you are well versed on these directional terms. All these directional terms. So if you have to make note cards, make sure you know what organs are in what quadrant, and make sure you know these positional terms, because they are going to come back at you quite often, and you are going to see them on exams. So your critical thinking question of the chapter is, you respond to a teenage boy who's taken a hard fall from his dirt bike. He's got a deep gash on the outside of his left arm. It's halfway between the shoulder and the elbow, and another on the inside of his right arm just above the wrist. His left leg's bent at a funny angle about halfway between the hip and the knee. So when you have something like this that's messy, draw a picture. Draw these injuries on a picture. And I want you to do this because it's really going to help you practice these terms. So draw these terms out on a picture of the human. And then we cut away the pants leg, there's bone sticking out. So I want you to write up how you would describe these injuries over the radio. Okay, I'm not going to collect this, but I really want you to do this. It's going to help you with radio reports later. And it's going to help you start getting used to using these terms. Okay, so think about what you would call in on all these injuries to the hospital, get it written out. And that ends this chapter.